Good morning, our viewers on MBC. This is Good Morning Malawi program, and inside it we have this segment which our friends from AFIDEV and AUDA-NEPAD have a conference in Lilongwe concerning the healthcare technologies. With me here, I have Mr. Dr. Elia Zulu, Executive Director for AFIDEV, and Dr. Masingat Sipuka, Chief of Staff from AUDA-NEPAD. Good morning.
Good morning.
Yes. First of all, tell us what the conference is all about.
So there are actually two sets of meetings. Monday, Tuesday is a meeting where a body of the African Union called a high-level panel for emerging technologies. It's called APET. They are meeting to review a monograph on application of emerging technologies on healthcare. And then on Wednesday and Thursday, there's going to be a regional policy dialogue, still on the same topic, looking at the role of emerging technologies on how to address Africa's pervasive health challenges.
Now, Dr. Sipuka, as NEPAD, how are you coming in this conference?
No, thank you very much, and we appreciate being in Malawi. We are based in Johannesburg, so our team has come through. Firstly, if we speak broadly about the context of our organization, African Union Development Agency, NEPAD, is, as we say, the development agency of the African Union, and its role is really to drive implementation of development programs and the implementation of Agenda 2063 across the continent. And as part of the role that we have, firstly within the context of our own programming as an organization, science, technology and innovation plays a crucial role in terms of enabling the development space and ensuring that we're able to advance in areas of health and education and industrialization and all other facets of development. And the work that we do, secondly, is we serve as a secretariat to the high-level panel that my colleague Dr. Zulu has just indicated. And that's where we come in. Firstly, in context of the meeting, is that we are supporting the convening of that meeting, and jointly, of course, with our colleagues from AFIDEV, is we are working on this regional conference. So our role is I call us the development implementers or implementers of development in the continent, and this is a crucial discussion within that context. So that's our interest, and so that's what we do.
So far, how have been the status of these technologies in healthcare in Africa?
No, absolutely. I think where we are is that we are developing them. We know from the review of our first 10 years of Agenda 2063 that despite much progress that countries have made across the continent, there remain a lot of challenges, and those challenges speak to various aspects in terms of prevention of disease, in terms of access to healthcare, in terms of data that is able to guide decision makers on investments on healthcare and all of these other things. So the discussion on technologies for healthcare comes in from that context. And I do think that we are not sufficiently developed. There's still a lot of room for us to make investments in terms of those technologies to advance the response to all of these questions that I'm talking about. So that's why we are interested in it. It's nascent. It's a growing area of work, but our role is to unlock the ecosystem and make sure that those who have the responses that are driven by technology at least find a space that is fertile for their ideas to be embedded into the system in terms of providing solutions. So yes, there's a lot of room, but I think what we have from our side is the political will that is coming out, driven, for example, by the likes of APET and other interventions that are out there to make sure that our decision makers know the potential of technologies in the healthcare sector.
Now, Dr. Zulu, what have been the challenges that have affected the implementation of these healthcare technologies in Africa?
So, no, the technologies that the convenings this week are looking at are what we call emerging technologies. So these are different from just general technologies. These are technologies that are quite different from normal medical care. You know, a vaccine is medicine, but it's also a technology, right? But those have been part of the routine medical care. Here we are talking about innovations that are coming up. You look at technologies like how do you apply artificial intelligence to improve medical care? How do you use drones? We see a lot of times, even you guys in the media use drones to take videos and so on. But drones can be used to deliver vaccines, medicines to the areas that cannot be easily reached. There is gene-drive mosquitoes, which can help eradicate malaria across the continent. So these are technologies that have been developed, a lot of money spent on them, but they are not part of the typical, in the health sector at least, not part of the typical medical care. So that even if it was proven to be effective, you need to develop new regulatory frameworks on how you embed them into the systems and so on. So this whole issue, part of the problem that we've had is that there hasn't been a lot of involvement of African experts, African scholars, even policymakers in the development and as well as application. So a lot of what we are doing, our partnership with AUDA-NEPAD, is to make sure that there's greater awareness, that there's more African voices in trying to assess and understand these technologies, so that if they are proven to be safe and effective, then we can push for their wider application in the government system, so that we can then improve our medical care. I think Africa, they really present a big opportunity. They can help the continent leapfrog a lot of the challenges that are there in terms of medical care, but they are not as well known as they should, and their application is not well understood. So part of this is just to make sure that we go beyond the science to see how we actually get them applied into practice.
How about funding? Are you okay?
Funding, I mean, part of the issue is also that a lot of them are funded externally. But I don't think that having technologies funded externally is a problem. I think what we're trying to do on the continent is to say, let's optimize the resource base of the development agenda. So part of the resources can be locally driven, part of it can be externally driven. But for technologies that are funded, whether through external or local resources, the point is, how do we make sure that those that are safe and effective are actually integrated into the systems? But of course, lack of funding is one of the big challenges, and I think our colleagues at AUDA-NEPAD are also looking at these issues from at the global level around the continent.
In terms of maybe success stories from other countries, do you have maybe examples of countries that are doing well and where maybe some countries can learn from them?
No, I think the question that you're asking is vital because it's one of the things that we need to get right in the continent. We have to understand where these technologies have been applied, where they've yielded results, and what that application process has looked like. Because as you sit in Malawi, effectively it means that you don't have to reinvent the wheel as you think about a particular technology in a particular sector. If we have the context that we've created or that we can extract from that has got these experiences. And I think that's a crucial role for organizations such as ourselves as AUDA-NEPAD, and of course working with partners like APET to harness all of these continental experiences and to put them together in a succinct and precise way and share them with policymakers, share them with people who are responsible for the policy process, and say, this is what country A has been able to do on this particular technology. Yes, the context may be different in your country, but more or less these are the applicable usages and the benefits that you can derive. So that's at a contextual level. But I think practically, you're seeing these technologies in use across the continent in countries such as Kenya. They are doing very good work. You're seeing across the continent countries such as Nigeria, countries countries such as Ghana, where there is an application of all of these types of technologies. And it goes beyond the healthcare sector. Yes, the conversation in this situation that we are in over the next 4 days might be focusing on the healthcare sector, but the application of these emerging technologies the uptake is very fast. But the important issue that has come up in the discussions that we've had is that the youth are at the forefront of driving the adoption and the utilization of the technologies. And they're not waiting for policymakers to set the policy landscape. And they are taking the lead. And these technologies are also, even within the context of health, beginning to create opportunities for economic livelihood for many of our young people. And they are supporting to address other developmental challenges that we have across the continent. So yes, examples are there. We have to coordinate the extraction of those examples and share them across the continent. And the third point is really that at the heart of that adoption process is our youth, and that's what we need to unlock for ourselves.
But I mean, the point actually, this convening is about the sharing of those experiences, because for the 2 days, each of the technologies, there will be evidence that will be shared to show where it is being applied and what has been the experience. So the partnership, AUDA-NEPAD and APET, is really bringing experts from across the continent, especially the meeting on Wednesday and Thursday, that is going now to allow people to share the experiences with technologies, which ones are working, where we need more effort and so on. And we need to do more of that, because in the end, we need to bring these innovations to scale. But you have to bring to scale what is already working, and part of the evidence is what will be presented in this convening.
Now, in less than a minute, Dr. Sipuka, how do we conclude?
How we conclude is, for me, what we've just landed on now. The sharing of experiences is absolutely vital, but the sharing of experiences of what has worked and what has not worked, so that we understand why certain emerging technologies have not been able to be adopted in certain countries. It will, I think, further unlock their ability to be implemented. That's point number one. Number two, we have to bridge the gap between these conversations and the decision makers within our national settings, which is our policymakers and the executives, etc. And number three, which is absolutely vital for all of us, is how do we unlock their ability to address our development challenges beyond simply the sector that you are talking about, i.e. health, but using emerging technologies in health in order to drive other development aspirations that the continent has, like employment, economic livelihood, etc., etc. So it really offers a great opportunity for us as a continent. So this is a good investment that we are making.
Dr. Zulu, machidule mchichewa kuti msonkhano mene muli nawo kuli Longwewo kwenikweni ukuti chani?
Msonkhano huu bunge lathu la APET mukugwirizana ndi bunge la AUDA-NEPAD tabweretsa akatswiri amene amapanga za science ndi technology kuchoka m'mayiko ambiri mu Africa muno, kuti adzaone kuti kodi technology imene yoti zapangidwa posachedwa apa zambiri zoti kalero kunalibe, zoti zitha kuthandiza kutukula miyoyo ya anthu. Zina zimakhala kuti zina za kujeni za agriculture kumalimidwe, zina za umoyo, kwenikweni tikuyang'ana za umoyo. Kuti kodi ma technology amenewa anthu amayuza ma drone tinthu towuluka tije timatha kukatula zinthu kumalo kuti galimoto sizingafikeko. Pali artificial intelligence, pali ena kuti amafuna yambe timaudzudzu titoti tizidya udzudzu weniweniwo kuti udzudzu amati gene drive mosquitoes. Tsopano ma technology ngati amenewa kodi zikuyenda bwanji mu Africa muno? Ndi mayiko oti amene akugwiritsa ntchito, mavuto amene akuapeza ndiotani? Kodi kuti tayike kuti atakhala kuti awawa ndioneka kuti di atha kugwira ntchito bwino? Kodi titha kuwayika bwanji m'malamulo aboma kuti maboma awalowetse m'malamulomo nkuti athandize kutani kutukula miyoyo ya anthu ambiri? Ndiye meeting imene msonkhano umene uli kuno wonena kuti amati emerging technologies, ma technology amene oti akupangidwa panopa oti kalero kunalibe, kodi tagwiritse ntchito bwanji kuti athandize kwambiri kutukula miyoyo ya anthu. Ndi zimene tikuchita ndi AUDA-NEPAD. AUDA-NEPAD monga mudziwa ndi bungwe la ku African Union. The African Union ili ndi Agenda 2063 imene mujasa ananena kuti science technology chofunika kwambiri kuti dziko la Africa litukuke ngati mmene anatukukira maiko ena. Sitingapite patali posapanga zinthu zachitukuko zokhudzana ndi technology. Ndi mbali iyi tikuyang'ana kuti kodi ma technology amene tingapititse kutukula za umoyo wa anthu ku health kwenikweni ndi oti. Ndi msonkhano ofunika kwambiri ndithu.
Tathokoza kwambiri.
Ziko
kwambiri. Nkhani tu ndimeneyo ya msonkhano amene ukuchitikatu mu mzinda wa Lilongwe. Mungati mitamvera tinayi ndi akuluakulu awiri apapa. Dr. Elia Zulu amene watu ndi wamkulu wa APET, komanso tinalinso tu ndi mlendo iwatu kuchokera kucha ku NEPAD, iwo watu ndi Dr. Mzingati Sipuka, kukubweretserani ndithu mu programu imeneyi ya Good Morning Malawi.